I need my supplement because at the end of the day, I'm not getting enough of whatever. And with original Medicare, basically your Part A and your Part B will only realistically cover about 80% of whatever you have going on. So meaning this, that you're in Part A and Part B, you're going to have deductibles on Part A and Part B, but then it also realistically only covers roughly 80% of whatever you have kind of going on. And that's in perpetuity.
Welcome back to episode 5 of the
Brad and Mike Show.
How about that? Kind of cool. I know we talked earlier on episode 4 about our new
picture.
Yeah, logo stand. I don't know how do we call that? We're not cool like Joe Rogan with a neon sign or anything, but I think that's pretty cool for you and me, right?
Well, look, if you like and subscribe, maybe someday we will get to Joe Rogan.
If you like and subscribe us, maybe someday we'll be able to afford a neon little sign back here that says Brad and Mike Show in blue.
Yeah. Well, I mean, right now it's just 2 colors, you know, maybe we get more colorized.
Yeah. If you, again, like and subscribe, and then we can.
I like you guys.
Yeah.
Like and subscribe.
So we're going to talk about Medicare supplements.
Yes, we're going to talk about Medicare supplements. That's exactly what we're going to talk about.
Medicare supplements pair very nicely with Medicare Part A, B, and D. And actually, we'll talk a little bit more specific about Part D, but Medicare supplements pair nicely with Medicare Part A and Part B, and the billing is very seamless. And it's a much easier circumstance for Medicare to bill with a Medicare supplement. Is that a fair statement, Michael?
Yeah, it definitely is. Because, I mean, the reality that you have with a Medicare supplement, just think of the word supplement. You know, it's kind of like people take their, whatever supplements, their vitamin supplements because they're multivitamins because you're not getting enough.
They're Centrum.
I need my supplement because at the end of the day, I'm not getting enough of whatever. And with original Medicare, basically your Part A and your Part B will only realistically cover about 80% of whatever you have going on. So meaning this, that you're in Part A and Part B, you're going to have deductibles on Part A and Part B, but then it also realistically only covers roughly 80% of whatever you have kind of going on. And that's in perpetuity. That's the word for the day, perpetuity.
So if I'm out jumping off high stuff and I fall and I break my leg and I have a $10,000 hospital bill, my Medicare Part A and Part B is going to cover 80% of that, and I'm going to pay 20% of that out of my pocket, which means that I'm going to pay out of the $10,000, I'm going to come out of pocket $2,000 on that. And again, I assure you, if you jump off something high and you land and you break your leg, probably your bill's going to be more than $10,000.
Well, especially for you.
Well, true.
Well, you're old, but you'll break other stuff that you land on.
It wouldn't just be an ankle. Though I have broke my ankle twice, coincidentally jumping off high things. So I've tried to avoid
You're speaking from experience.
Yes, indeed I am.
Nice.
Yes, indeed I am.
Ah, there you go.
Right ankle twice, right wrist twice. So
really?
Yeah, I landed on my right side.
You don't fall to your left?
No. Well, apparently not those 2 times.
No. Well, don't try it for a third time just to make sure. Three strikes and you're out.
That's correct.
It fell to his right side again. This time it wasn't so good. Well, not good. So
Medicare supplements.
Yeah. So Medicare supplements, realistically, when the main thing that people have to remember is that when you become eligible for Part A and Part B, you then create basically your initial enrollment period that you have the capability to participate into a Medicare supplement. Now, with Medicare supplements, what's really nice about these is that they're regulated. They're regulated by the federal government and by the states, meaning that if there's this particular plan. So basically what you're going to find is when you kind of do some research, you go out online, you're going to see that they're going to have letters.
Are you saying that all the plans are the same? They all cover the same thing?
Yes, they have to.
If it's a Plan N, it's a Plan N, regardless of what carrier has the Plan N.
Yes, or it's a Plan A. Plan A is a Plan A is a Plan A is a Plan A.
Indeed it is.
Every carrier is identically the same. The crazy thing about this is that when you look at the different Medicare supplements, and I truly mean this, when you go out and you see all the different plans, there's a different rate on every single one of them.
I know. And you're like, well, if it covers the same thing, why is one carrier charging more or less than the other carrier?
Oh, because it's based on their risk. I mean,
there are a lot of actuary issues or things working behind the scenes that dictate rate that we're not going to necessarily get into. We want to talk about how does a Medicare supplement coexist and work with Medicare Part A, and what do you do about Part D?
Well, yeah. So Part A and Part B you're going to have in order to basically enroll into the program, into the Med Sup at that point in time. And so depending on which one you choose, and I truly mean they're the same difference, pick who you want. It's kind of like when my wife or my daughter does the basketball tournament. Well, who did you pick to win? Well, I like the color the best, or the uniform
with the nice outfits. They say.
I like their nickname.
Yeah,
really, that's how you did that. Yeah, and inevitably, like my wife or my daughter does very well, kicks my butt. My son, it's like,
well, it's just because everyone knows that these things are just pure unadulterated luck. It's
yes,
just luck picking the bracket,
but not so much with a Medicare supplement.
No, it's not.
It's not. But along those lines, the main thing that you're going to have with it is the rate's got to be different from one company to another. And so be aware of that, because a plan A is a plan A is a plan A from carrier A to B to C. It's the same because they're mandated to all cover the same thing. So the different types of things that you're going to see in your Medicare supplement plans will be, does the plan cover your Part A deductible? Does it actually have any type of coverage for, going in for surgery and things like that? Are there balance bills that are going to be taken care of there? Each one has its own little scenario that it's taken care of. But when you look at all the plans, there's a nice graph that basically shows you what's covered, what's not covered by each one of the plans. And it's a little bit of a nuance between the two.
True.
But along those lines, what you're going to pay for is going to realistically be how much more of this is covering what's not covered by my original Part A and Part B of Medicare. So the more that you're going to pay, the reality of that is it's going to basically cover more stuff.
Which goes back to our mantra: you're either paying the insurance company or you're paying the doctor who treats you, but you're going to pay one way or another.
That's right.
But with a Medicare supplement, oftentimes people will gravitate towards a supplement because the out-of-pocket exposure is somewhat more mitigated than a Medicare Advantage.
Absolutely. And that's really why. That's why so many people look at that. Now, what's different about the supplement is that there's going to be a rate on that. And that rate's going to be based on your age at that time each year. So there's going to be an increase.
That's true. So when you're aging in at age 65, it's guaranteed issue.
Yes.
Right? So you get
Great
it.
point.
And it doesn't matter what your health is. You could have one foot on a banana peel and one in the grave, and they'll take you and they will cover you. And oftentimes people we talk to that do have a lot of health issues, how a Medicare supplement plan does make a lot of sense for them because, again, they have a lot of usage. But if people that call in and we speak with them and they say, I don't take any medications and I'm in great shape and I'm out running marathons and doing all kinds of good, maybe a Medicare supplement isn't necessarily the right path forward. However, it is also about what their risk tolerance is.
That is correct.
Some people simply do not want to have to worry about any exposure at all. And a Medicare supplement plan is a really good fit for them. But as Mike just illustrated, each year that rate is going to tick up. As you age, that rate gets higher. And so we can say with certainty that it is guaranteed issue your first bite at the apple. But after how much time?
So after you get the policy, you have basically the first year. So if you're turning 65, you get into it. And then let's say, for instance, you want to go to a Medicare Advantage plan. You basically have a 1-year freebie look at that point in time to come back to that plan if you want to. Now, the main thing just to remember in all of this is that that's early on.
That's early on.
So,
that's correct.
Correct. After that time, though, it's full underwriting, and so they basically. So here's the big thing. So that's
100% true.
If you're on and it's time, and I see this happen quite a lot. People have them, and they're 7 years old, then 75, then they get up closer to 80, which is pretty much the max that they charge you. As 80, you're kind of, pretty much
grandfathered in, so to speak.
Well, yeah, but
no pun intended.
Yeah, but you're 15%, 20%, whatever is going up every single year on that.
And it gets expensive.
It does.
It gets untenable later ages in life.
If you're on a fixed income, by all means, that's when you might want to take a look at a Medicare Advantage program. But however, though, the main thing that you always have to remember is that as those rates go up, you know what? If you're in fairly good health, so going back to that person that's not on any medications, doesn't have a lot of issues, they realistically could go to another carrier and say, hey, look, I want to see, what my cost would be to, come over to you. And one of the big things that you have, and I always try and tell people a little bit like this, is that when you have a Medicare supplement and you want to go through underwriting, it's very similar to life insurance. So meaning they're going to ask you a whole lot of questions. What's going on? They're going to dig everything up. What's been going on? Blah, blah, blah. And the main thing is what you have is if you don't have that, there's not a whole lot of an issue that you're going to have from the carrier coming back to give you a rate. Now, where I'll go with this as well is that if you have the capability to do that, it makes sense to to shop it out every couple of years because
It does.
you can go from carrier A to carrier B if you're healthy, and you may get a better rate than somebody that's just coming in on a guarantee issue basis because they're now taking a look at it to say, I'm looking at you specifically and what your health is. And when that happens to be the case, you could get a better rate. Now, at the same time, if you're a mess,
you're going to get rated up or maybe declined.
Yes, you could be.
You can be declined.
Yep.
And when people say, well, how will they know? Every
They
time
know.
you go to the doctor and your doctor's typing in on his laptop, that information is going to Medical Insurance Bureau, LexisNexis. It's going to the clearinghouses, right? It's going to the clearinghouses. They aggregate all that information, and all the insurance carriers have access to that information. So they know. And there's no way for them not to know. They know what medications you're on.
Oh, yeah.
They know exactly what your doctor visits were, why you were in there. Did you have a sore throat? Did you have a cold? Did you have COVID? Whatever it is, they know. Believe me.
Were you picking your nose too hard?
Well, could be.
Yeah.
Could be.
Okay.
You get a gusher there. But anyhow, that being
Pick a winner.
Chicken dinner. That being said, the advantage of a Medicare supplement plan right out of the gate, guaranteed issue, especially if you have health insurance or health issues, it makes a lot of sense for people. You can always come back to a Medicare Advantage plan, and a Medicare Advantage plan isn't underwritten. So you can always go to a Medicare Advantage plan.
Mm-hmm.
But moving from a Medicare Advantage plan to a Medicare Supplement plan means that you can be underwritten if you decide to do that after a year has gone by from the point that you aged into Medicare. So you just need to be aware of what the rules are. And then, of course, there's Medicare Part D, because Medicare supplements do not cover, like Medicare Advantage plans do, your drugs or the medications that you may take.
That's correct. So you have to actually do a Medicare Part D.
Which is a separate plan with a separate cost.
Yep. So some
be
plans,
aware of that.
some plans are zero premium.
That's true. That's true.
You know,
That's
which
true.
are out there and that type of thing. But you same type of thing like we talked about before in our previous podcast of, you know, the prescription drugs, the different tiers, the formularies. So you have to be aware of that each, you know, there's going to be some that are going to be, you know, very inexpensive, but they might have a deductible on them.
That's true.
But at the same time,
you're going to want to always plug in what your medications are.
Yes.
To make sure, because you don't want to buy a plan and then turn out that the medications that you're on aren't covered and you're coming out of pocket full for that. That's crazy.
Yeah, because there's going to be options. And that's the main thing to remember. But you'll actually need to, you know, kind of going back to our previous one, you know, you're going to still have to make your Part B premium payment on a monthly basis.
Correct.
You're still going to
always
have to
Part B in all circumstances, whether it's a direct ACH from your checking and savings account or through Social Security. You always pay Part B.
You're always paying for that. But then you now tack on the Medicare supplement cost on a monthly basis, which does go up every year. And then the Medicare prescription drug Part D. So that basically is going to be something that you're going to have to add on. So you'd really have three component bills in regards to that. So, you know, even if you did Medicare Advantage, you're still going to have your Part B, but then you'd only have in some cases, unless you're on a zero premium plan, a second. So there'd only be two costs associated with that.
Realizing that, again, and I sound like a little bit of a broken record here, you're going to pay the physician up front or the carrier. It's one or the other. And, you know, those people who have a lot of health issues, a Medicare supplement plan makes a lot of sense.
Well, yeah, because they're, you know, kind of going back to it. You either pay the doctors, you pay the hospital. So if you're going to be paying the premium on that, that's going to give you the best scenario where your out of pocket is so mitigated with having that, you know, original Medicare plus that supplement. Another thing that we didn't touch on as well, though, is with a Medicare supplement plan, you're basically going to have two cards. So you're going to have your red, white, and blue card, which is your original Part A and Part B. You need to present that to the doctor. And then the other part is going to be your Medicare supplement. So you're going to have to obviously give them that card. So the doctor on the back end is going to take care of everything for you. But remember that there's going to be two parts to that. So you have to make sure that you're going to have both cards when you go and you actually see the doctor. The other big thing that you do have as far as with a Medicare supplement is it doesn't matter where you're at. As long as the doctor takes original bills and Medicare,
and
you're not out of network.
One thing we didn't mention that we should mention, Medicare supplements do not have provisions for dental, vision, hearing.
Oh, that's right.
There's no silver sneakers. Gotta love my silver sneakers. There's no OTC. There's no additional benefit. It is truly just the exposure you have on Part A and Part B.
So it's not the multivitamin.
It is not the multivitamin. No,
it's close. It's close.
Actually, no, it's not close at all. No, that's it. And everyone's tolerance for risk is different. Everyone's circumstance is different. What we always encourage people to do is give us a call. Give us a call so that we can figure things out for you.
Give us a call, or at the same time, go visit us at bradmike.com. You can set up a meeting with us. Happy to have a conversation with you. We talk to lots of people all the time.
Yeah.
I mean,
we got into our website because we have a really good, really good information in there related to Medicare, specifically to Medicare Supplements, Medicare Advantage plans. And there's a lot of stuff that people will just get a sense for. We had a call last week. I said, I feel like I've already met you because I watched your podcast. I was like, that's cool. That's very cool. So again,
did they say, were you the fun one?
I think they did. Yes. Yes. So again, you got to subscribe and like, and that helps us a great deal so that we can continue to bring this content out to
absolutely
masses.
Yeah. And at the same time, if you do have questions that you want answered, we could probably take those from me and put you in a podcast with regards to answering those questions.
We're going to do that. We're going to put a third chair in here at some point, probably right here in the middle. I don't know. We'll figure it out, but
figured out.
Yes. We're going to do that at some point.
Love it. Well, hey, thanks everyone for tuning in, and look for our next episode coming up here shortly. But I'm Mike Ritter.
I'm Brad Bachman.
And give us a call at Brad Mike. Your benefits done right. Take care.
Brad Mike Show. Take care. Bye-bye.